Welcome to the Whole Health Podcast,
where a functional nutritionist and a biological dentist investigate the interconnectedness of your health.
Let's get started.
Welcome back to another episode of the Whole Health Podcast. I am so excited today to invite and welcome one of my dear friends and mentors, Dr. Phil Mollica from glorious New Jersey. Yeah, welcome, Phil.
Better than that.
Welcome,
Thank
Phil.
you very much.
Yes. So Dr. Phil Mollica is a pioneer in the development and integration of ozone therapy in dental medicine. He was introduced to ozone therapy in 1997 and developed today's standard of care in ozone dentistry. Dr. Mollica trains doctors worldwide in ozone therapy and biological dental applications, as well as being an international lecturer, trainer, and author in ozone therapy and integrative biological dentistry. He has a private practice in Saddlebrook, New Jersey, with his wife, Dr. Karen Rockefeller. And I'm going to leave it there because we got so much ozone stuff to talk about. But I want to share with our audience that I had the great pleasure and have had the great pleasure of going to Dr. Mollica's office a number of times. I think I've been there at least 10 times now.
Oh, yeah.
And I was a student of his at the American College of Integrative Medicine and Dentistry. My hat is off to you for all that you have done for our profession and continue to do. And I'm so happy that I get to participate now in the teaching of that wonderful institution. And today we are going to dive into the wonderful world of medical and dental ozone. So welcome, Dr. Mollica.
Thank you very much. Pleasure to be here.
So I think it's probably a great place to start. A lot of our listeners probably have no idea what is ozone, and why don't we just start there? What is ozone?
Ozone easily is really basically energized oxygen. You need energy and energy form to form ozone. Ozone is what's called triatomic oxygen, or three oxygen molecules bound together. A normal oxygen in the atmosphere, the things that we breathe, is what's called diatomic oxygen, which are basically two oxygens itself. But what happens is that with an energy form, let's say the sun, the energy from the sun, it comes down and basically puts that energy in the protection of the ozone layer. You hear about the ozone layer. The ozone layer protects us so we can live and thrive on this planet. Absorbs the energy from the sun and basically from an energy form, we get the triatomic oxygen. It's a very unstable molecule. It comes and goes. But once again, it sanitizes and cleans the atmosphere, and is one of nature's wonders in the world itself.
Wow. That's interesting that, because you hear so much like negative stuff about the ozone layer, and as it turns out, it's like a self-cleaning system for the planet.
Well, it really is. I mean, it's funny, when I lecture, I talk about, you have ozone action days. Oh my God, ozone, put duct tape on the windows, okay? We're sealing in. What happens is that ozone is so easily to measure. So the higher the concentration of ozone in the atmosphere, let's say in LA, okay? Once again, the higher the concentration of ozone, the more pollution there is, because pollution is made up of thousands of different toxic chemicals. So how do you measure that? You measure by using ozone. Once again, Mother's Nature way of cleaning up the atmosphere. So the higher concentration of ozone, the more pollution is present. But people say, oh my God, it's the ozone's getting us. No, it's the ozone that's helping us survive these pollutants that we do make.
Fascinating. I've never understood it that way.
Hmm?
That's the most clear explanation of ozone I've ever heard. Thank you for that.
You're welcome.
What was that, 3 minutes? This
yeah.
is great.
Come on.
That's it. Thank you. Good night.
Nice to meet you. Goodbye.
That's right. A pleasure.
I'm sure you have questions.
I have so many questions.
Yeah.
And I feel like I'm jumping ahead a little bit, but when you're utilizing ozone in a medical setting, how is it stabilized? You said it's pretty volatile. How do you stabilize it, or how does that happen so you can utilize it in somebody's body for that purpose of cleaning, killing, et cetera, whatever you're using it for?
Well, the trick with ozone is that it has to be utilized and fabricated immediately, okay? It's a very unstable molecule. So if we're treating a simple wound or something like that, we're making a certain concentration of ozone, and we use it immediately. If we leave it, it will denigrate itself down, okay? And the interesting thing is that we use in the biologic world, we use very, very little bit of ozone, micrograms of ozone, but it has such a biologic cascade effect throughout the human body. So whatever the multiplicity of different therapies we can talk about, it's always micrograms of ozone that create this biologic effect on the human body that's so positive in multiplicity of different ways.
Okay. How did this become a tool that you found useful in your practice?
Well, it's an interesting story. I was working on a doctorate of integrative medicine down in Washington, D.C. in the late 90s. And so one day, one of the naturopaths come in, we have a naturopathy program also there. And he says, okay, today we're doing ozone therapy and ear candling. I'm like, what the heck is that? Ozone? Man, that will kill you. Oh my God, So, of course, we did this ear candling, old ancient technique. You put this candle like on a candy cone in your ear, you light it up. Oh, very nice. Little essential oils. Oh, beautiful. Then comes this ozone thing. So he had this little box, an ambient air ozone generator with a stethoscope attached to it. So you put it in your ears for a couple of minutes. Okay, that didn't kill anybody. I made sure my friends went first, of course. And it didn't kill them. So I tried it. Fantastic, okay? So, of course, being dentists, we're very concerned about where we're having lunch, of course. We're in D.C. And we go down to Union Station, beautiful place, right? And we're like having lunch. Says, man, you smell ozone? Like, oh my God, it's coming out of our skin. Not realizing the properties of ozone that go where any inflammation or infection is. Traveling, you get inflamed and whatever. And so I go back and see Dr. Hutto, who taught us this. I said, listen, is there anything science behind this ozone thing? Oh, yeah. He hands me a book from a dear friend of mine, Renata Vivon, at the medical applications of ozone. So I'm reading this book and I say, oh my God, all the issues we have in dentistry are explained in this medical book, but not applied to our dental world. So, our two primary, issues in dentistry are what? Trauma and infection, okay? So how can we help the body support the healing process using ozone? And also, how do we reverse, once again, infection, whatever that might be? So what is infection? Basically, it's, it could be fungus, it could be virus, it could be bacteria or parasite forms, okay? The interesting commonality why these bugs are so susceptible to ozone is that they have very weak or no antioxidant systems in their cells. And ozone is a what? An oxidative therapy, okay? So we're oxidizing, doing an oxidative stress on these bugs, and they can't handle it. So they succumb to that. And the beauty of it is there's no toxicity if used correctly. You can't get antibiotic resistance because this is an oxidative therapy. So we're using the body's own natural resources to attack and, once again, get this body more of a balanced ecological system. And that's what it really boils down to, ecology. Remember, we're like a little pond, okay? And depending on what your situation or your ecosystem like, that dictates the health of your wellness of your body. 90% of us is bacteria, not size-wise, and 10% mammal. We spent decades and decades destroying that 90%, and we're paying the price for that now immunologically. We're here, if we're smart, we can use ozone to once again get those pathogenic forms off the body, let the body's immune system upregulate and balance, and make a healthy, functional ecosystem, the human body itself.
Okay, sorry.
Go ahead.
I can't help myself
I know.
here. Okay, so with regards to the microbiome, now that you brought it up,
I did.
I'm really interested in how ozone works with the microbiome or the commensal microbes that we're trying to maintain versus, like antibiotic that goes in and can flatline the whole ecosystem. Is ozone something that can be used that is specific to the infection versus the commensal microbes?
It does have an effect on the commensal microbe itself. But once again, we have to think integratively. If we're dealing with infection, it's very important that we continue what we call weed, feed, and seed the gut. Okay, that's the key. You got to get those good probiotics in as you're eliminating the bacteria or whatever form that's pathogenic. Once again, it's the commensal bacteria. My point is that we have everything. Okay, we got it all. It's just a matter of what the environment allows to come up and erupt. Okay, so once again, If the ecology turns more or less oxygenated, more acidic, certain pathogenic forms, they're all opportunistic.
Right.
When they see the opportunity and the environment's right, they tend to emerge out. And that's what we call what? Infection.
Mm-hmm.
Okay. So our trick is ecologically, biologically, to reverse that, to have a clear, much balanced ecosystem and keep those commensal bacteria in check and balanced correctly to support the immune system. Because once again, if that commensal bacteria is not healthy and functional, your immune system wanes with it because they're totally involved with each other. Remember, where does your immune system live? In the gut.
Mm-hmm.
At least 80% of it, other than the dispersed type of immune system. So, you have to nurture the gut. Okay, that's, any kind of like naturopathic or holistic practice, where do you start? You got to fix the gut. And where does the gut begin? Right in the oral cavity. It always amazed me. Physicians look at tonsils, right? Oh, and they pass a toxic waste dump. There's root tips, bad canals, pus. Them tonsils look okay. If you got any infection in your mouth, your tonsils are infected, by the way. Okay? So you have to always, part of our protocol is, once again, if we're cleaning up the head and neck using ozone, we're also treating those tonsils and the lymphatics. It's all part of a comprehensive look at the human body itself.
Absolutely.
So I'm curious, Phil, in your experience, what are the more common ways that ozone's utilized in medicine?
Well, in medicine, there's a multiplicity of ways. I mean, there's basically, I would say right now, basically three fundamental, well, a lot more, but three fundamental ways ozone's used. What's called major autohemotherapy, which is a technique that's been around for decades, okay, but it's becoming much more sophisticated. Basically, what it is that for more advanced chronic diseases itself, they'll use this therapy. What it is, basically, you draw 50 cc's of blood into a specific vacuum type of glass bottle. You bubble 50 cc's of ozone into that blood, and then you reinfuse it. Well, what does that do? Once again, we're adding information to the human body. For the human body to function right, it needs good, clear, coherent information. A lot of time, immunologically, you have an infection going on, and your body doesn't even recognize it. We're here, through these therapies, we're able to re-educate the body. There are immune cells that are in that blood sample, and those, what we call antigens, are that information. We oxidize it, two types of white blood cells, gobble them up, and start producing what's called cytokines. So once again, that stimulates and balances the immune system. The interesting thing about ozone with all these medical applications, number one, it has an interesting fact about the immune system. It modulates the immune system through these therapies, okay? What does that mean? If you're inflamed, it brings out inflammation. It's an anti-inflammatory. If the immune system is not regulating and functioning right, it upregulates it through the educational process to function better. So major autohemotherapy, another wonderful trick, which is amazing, is called minor autohemotherapy. And this is a great way to get rid of seasonal allergies, herpetic lesions that keep recurring, especially in dentistry, but you need the information there. So basically what happens, let's say, typical dental patient, you treat them, they get the herpetic breakout. If that information is called antigens, it's all over the place. So what you do is you draw a simple process. You draw up 1 cc of blood and 3 cc's of ozone. You shake that thing up, and it's now an auto vaccine. Once again, information going back, and now your immune system can recognize that issue and deal with it. Seasonal allergies, you need that information, which is what? The allergy is starting up. You need that information, create that vaccine. And I'm telling you, it's amazing how you can eliminate all these allergies in something so simple, information. Another wonderful technique that has been developed over the last couple of years, I've been doing a lot of research through the Ozone Academy, is called EBOO. Now, EBOO is an incredible process where basically you're doing, basically kidney treatments, okay? And as you're doing that dialysis process, you're ozonating the blood at the same time. So this is for, for more kind of people that don't respond to typical major autohemotherapy or minor autohemotherapy. A little bit more advanced technique because you need blood in, blood out. You got to heparinize. It's a little more complex. But the interesting thing is that they have a filtration system. It filters the blood as it's going through and oxygenating it and ozonating it. Well, we're finding in those filters plastics, nanoplastics. by the ton. So, we're becoming plasticized. You don't even know it. So we're trying to figure out, analyze where this is coming from, other than the typical filtration, the fatty acids or whatever that's filtered out on that filtration system. But the big thing is plastics. How the hell do you get rid of plastic? We know how to, if you become heavy metal, you know as well as I do, and you can do chelation, whatever the case may be. So we can gently, carefully pull the metals out that way. But how do you get rid of plastics in the system? So minor hemotherapy, EBU, and once again, the major hemotherapy is another way. Other than that, another technique is direct infusion into the joints of the body. Regeneration of knees, shoulders, backs. I have the blessings of having a physician here in New Jersey that is infusing ozone into the back. It shrinks. If you have bulging disc and inflamed joints, he's an anesthesiologist. So what he does, instead of using cortisone and all that, he'll go in, inject the ozone into the disc as he's coming out. He's injecting ozone through. And what happens is the disc actually shrinks back, and the nerve root, which is causing the agony, that shrinks also. What happens when you have inflamed roots coming out of the spine, there's a little foramen or hole, and it's very small per se. When the nerve gets inflamed, it swells, and that's where the agony comes from, by the nerve being pinched in there. And that goes down, and boom, the greatest thing I got from him was a couple of pictures in the mail. I said, what is it, Dr. Blaywise sending me? I opened it up. It's two pictures of backs, One has screws in it. The other one had this big plate of metal. He says, thanks, Phil. We don't have to do this anymore. I was like, whew, unbelievable. So, it's the beautiful thing about oxygen and an ozone. I always say oxygen ozone because let's say you take a little square of oxygen ozone. It's let's say 1 cc of ozone and oxygen. 99.5 or more percent of that is oxygen. Very little is ozone. But ozone creates a biologic cascade in the human body once you introduce it. Now, the interesting thing is that what it does is it becomes converted. It's actually, when you put ozone into a system, it immediately converts into what? Peroxides. It's hydrogen peroxide, but customized based on your system. So it's actually the hydrogen peroxides that actually do all the yeoman work. The ozone comes and goes instantly. It's the peroxides, as a result, are introduced into this biologic system. That's what does all the work, So in the beginning, you have basically hydrogen peroxides. But once those hydrogen peroxides start breaking up the membranes, let's say, of old red blood cell, pathogenic forms, etc., bugs, whatever the case may be, those membranes of those bugs become what called fatty acids, fatty lipid peroxides themselves. And there it's interesting. They perpetuate this oxidative stress to the system, but they're also signaling. They are messengers. This is why now we can see how the immune system is modulated. We can see how the body upregulates the formation of what? Antioxidants themselves. Because ultimately you want the body to produce what? Catalase, superoxidase. We talk about, glutathione. People that get IVs of glutathione. You want your body to make it because it makes more than we can possibly get an IV. You get an IV, that's super transient. It comes and it goes. It's a superficial treatment. What you have to do is get the cells up and functioning and doing the right thing, and they produce all the answers. But now we know the mechanism behind that. What's called transcriptional proteins. These proteins actually kind of hang out in the cell, and all of a sudden they get the oxidative stress. They get turned on, and then they give the DNA, which is the nucleus of the cell itself, and then they start producing proteins or antioxidant therapy. So the multiplicity of different biochemical reactions that we're seeing with the ozone. The other beautiful thing with ozone, once you introduce into a biologic system, is the upregulation of nitric oxide. You eat your beets, you get on, you have your, whatever, the big thing with beets and nitric oxide. Your body can produce it by the use of ozone. So this is where we see open up the vascular beds open up. Because once again, to have proper healing, you need blood flow. Blood in, blood out, lymphatics in, lymphatics out. And that's the real key. So ozone opens up that, collateral with that, a lot of research with that, seeing nitric oxide levels that go up from the endothelial lining of the arteries themselves, open up those vascular beds, and it supports, once again, the healing process. And that's the key when we think about biologic dentistry. Our job is, once again, to remove barriers to wellness and support the patient's innate healing processes. And that's one of the key. We don't have like, ooh, you're healed, hallelujah. No, the patient has to be their own best advocate, but we help them by getting rid of all that crap and toxins in the oral cavity, the mercury, sometimes bad root canals. And before Valerie Cantor was a dear friend, not all root canals are bad, okay? So I want to make sure she hears this. She doesn't come and stab me. She was just here a few weeks ago. So, once again, I mean, it's incredible the effect in this, the vastly different thinking in dentistry. We're just, we're in the biologic world. We've transcended beyond just the mechanics. The mechanics of dentistry are a beautiful thing. We like it. We like to put little implants in, fix the teeth, but it transcends that. We're very careful about what we put in the head to make sure it's compatible with the patient itself. And that, once again, getting those burdens off the patient. It's amazing the toxins associated with head and neck infections. Infected bone, bad root canals, cysts, abscesses. It's amazing. And the problem is with patients, amazing. Have a patient, and I'm sure you've seen this, where they come in, new patient, great. Wow. And you open up, it's like, oh my God, there's root tips in there, broken down teeth. It's like, did it hurt? Oh no, I never felt anything. Oh my God. It's absolutely amazing. And that's part of the problem with these infections, these stealthy infections in the head and neck, is that a lot of people don't feel it. We have technology now called 3D cone beam, where we can 3D. We can go inside the jaw and look around. And it's like, it's amazing how many abscesses you find or holes in the jaw, and you don't feel it. And that is, I'm telling you, immunologically, that is wearing you down. Your body's really an energy being, and that energy has to be redirected to try to manage that problem, okay? But now we can see it, and beautifully enough, you can explain it to the patient, but people are very visual today, okay? When I was a kid dentist, we had little tiny x-rays, little dippy things, and with the micro, oh yeah, I see something. You didn't see nothing, okay? But now with the technology, it's pretty amazing that we're able to look a little bit deeper and support these patients. They're surprised as hell, because once again, you have a patient that, God forbid, has a chronic disease like cancer, chronic fatigue. You have to clean up the jaws and the head and neck. Otherwise, you're going to get a partial result. And a lot of the physicians, especially that I work with, have recognized that. Partial treatments, partial results, okay? And, and a lot of physicians have recognized it. You just can't get them right. Look in the mouth. Oh, my God. Toxic metals. There's no biocompatibility. There's infections, periodontal disease. Man, gravity sucks, okay? What doesn't kill us is the bugs, okay? They want you to survive. It's their poop and pee that drains down and kills you. That's what it is. It's biologic toxins. And how the hell you deal with that? So once again, if you think biologically, ecologically, it's a different mindset, okay? And this is how, once again, recognizing and supporting that innate healing process. Because people can heal. It's amazing. Teeth can heal. It's a miracle. The teeth can heal, given the proper support.
Mm-hmm. So one thing I'd love for you to describe to our listeners, Phil, is, because I've had observers, even other dentists, come to classes where we have some ozone in a syringe, and what looks like air, is getting injected into a space in the body. Would you explain why it is that that's accepted? Obviously we wouldn't want to inject straight air, but what is it about ozone that's accepted by the body in a gas form?
We have to realize that it is oxygen and ozone. Air, ambient air, is what? 80% nitrogen, vastly different physics. You hear about the bends divers coming up too quick. That's a nitrogen issue. Nitrogen is very difficult for the body to deal with and absorb. Pure oxygen is absorbed readily into the system. So what we have when we introduce this oxygen ozone into the system, instantly, proven scientific fact, goes into solution. The oxygen is absorbed readily. So it's an oxygen therapy. And once again, the ozone converts into what? Those peroxides, and that goes right into solution. So vastly different physics. Now also, when you're talking about the physics of it, the beautiful thing about ozone that it carries what? A negative electrical charge. Okay, go on the quantum level. Negative electrical charge. Inflammation, infection is what? Positively charged. So I always tell my students, don't overthink the ozone. The ozone will know right where to go. Okay, it's drawn right into the area, especially when you deal with jaw infection, these cavitation things they call it, whatever. When you treat it with ozone, let the ozone do the thinking. You infuse the ozone into the bone itself, goes right in solution, those peroxides, beautiful, all negative charge. Because once again, when you think about infection, let's say, for example, in the jaw, it's three-dimensional. It's not a little ball sitting there. It doesn't work that way. It's like little fingerlets going out. So how do you get rid of that? Let the ozone do that. The ozone will track down. It's at the molecular level. It's a gas, okay? And that's the beauty of any of these infections in your oral cavity. Let the ozone do it. Caries arrestment, getting rid of simple things like caries. You got a tooth that, it's a vital tooth. Okay, great. And you have a large carious lesion. You clean out all the goop, and you get down where the dentin itself, the inside of the tooth, is pretty firm. But if you keep going, guess what? You're going to pop that pulp out, and that's something different. Let the ozone do it. Oxidizes it. Okay, you just blanket the area with the ozone at what's called 60 micrograms for like 60 seconds. It will super oxidize it, elevate the pH. Okay, elevates the pH. The infection is always what? It's acidic in nature. So it elevates the pH, and that allows for what? Remineralization. And that's the beauty of even bone or any hard tissue. What we look for on success level is remineralization, because those minerals that remineralize bone that has been infected cannot impossibly remineralize if there's any infection left. It's impossible physics. The minerals that go in to make the matrix of bone has a positive electrical charge. Infection, positive electrical charge. Once we see remineralization, we know what? Our success. We've had, once again, infection and inflammation is eliminated, and we see that remineralization effect. That with teeth itself also. That's been a proven scientific fact. And that's the beauty of it. The science behind this is sound at this point. We understand it extremely well.
I think I'm obsessed with ozone now. My mind has just been blown. I think I've thought of maybe 100 patients in this conversation. Why are they not using it? Why? Can you use sufflation into the oral cavity and just hold the ozone gas in your mouth as long as you don't inhale it into your lungs, just to let it circulate?
You can, but you know what? I mean, there's other methodologies for getting in there. I mean, you can use ozonated water. We're working now with ozonated glycerin with very successful outcomes on that. We understand the science behind them. Champagne, we're working with them on that, and ozonated oil. So there's a multiplicity of ways to go in that. The trick is, I mean, you talk about holding the gas. One of the most amazing tricks is putting direct ozone up in your sinuses. People have chronic sinuses. We have a technique where we tell the patient, once again, you got to breathe through your mouth as we slowly take a syringe of ozone and put it up their little nostril.
Okay.
And I'm telling you what, it's amazing. Opens up, the problem with sinus infections, you don't know what the hell is up there. It could be virus, it could be fungus, it could be bacteria. And it changes. I mean, I learned from my mentor years ago, you don't know what's there, and it changes daily. Remember, any kind of like bacteria, virus, fungus, they're all what's called pleomorphic. They change depending on the ecology of what's going on. That's a more complex issue with perio. We see pleomorphism all the time. But once again, you slowly dispense that ozone up there, and I tell them, listen, about 20 minutes, get ready. Blah. All the goop starts coming out, and it drains it. It's a beautiful thing, But it's simple. It works like that,
So can we go back to the stethoscope for a second, because that's just been sitting with me since you gave that example. Technically, could you ozonate the ears of little tiny children that have chronic ear infections using a little stethoscope? Why are we not doing this?
Well, there's a lot of research behind that. A good friend of mine from Russia has done a lot of research on what's called ear insufflation.
Okay.
It's a simple technique. I mean, I tell the kids to get swimmer's ear. We do the ozone gas. Okay. Once again, with the trick with ozonated gas for the ears, you have to moisturize it. So we always bubble it through water or put wet gauze around the little cups, because ozone loves to move in an aqueous environment. Okay. Moisturized environment. And then what you do in cases like that, put the ears on for 5 minutes. That's all you need. Okay. It does all the work. Once again, then you take some ozonated oil, put a little cotton behind it. Boom, done. I mean, they did studies where, explain that when they get into ear insufflation, that they compared it to all the other antibiotic techniques, all that, and they found ozone was just so much quicker to resolve and less, ear pain. Earaches are nasty as hell.
Right.
And, this really knocks it down in a quick and non-toxic way.
Right.
And, and once again, when you talk about toxicity, you remember go Paracelsus, the poisons in the dose, poisons in the dose. And the human body doesn't like these overwhelming things, which we've done for so far in the typical allopathic medicine. I'm not saying I love allopathics. They have great technology, whatever. But your body like, oh, you're nice. Easy does it. It doesn't like, ow. But
so true.
It's like, the principle of ozone application and as far as dosage, it's based on hormesis, which once again, less is more. Okay? Yeah. You keep increasing the dosage, the concentration, the body starts to go, oh, and to the point where it becomes toxic. So what we found, it's like homeopathy. Less is more powerful. It's all about information, stimulating the body to heal itself. That's what this ozone is all about.
Do you see ozone as a longevity strategy as well, just for those listeners?
Absolutely. I'm lucky I have a good nurse who knows how to stick a vein. So, so you can do. Now, another simple way, I'm telling you, which is extremely effective, is what's called rectal insufflation.
I have heard of this.
Yeah, it's amazing. I mean, friends of mine, ophthalmologists, have reversed macular degeneration. I mean, all these techniques. They say, well, it's like 95% as effective as IV. Well, it's a hell of a lot easier taking a little cannula, shoving up your butt. Sorry, Kelly. And
yeah, sorry, Kelly.
And squeezing, 250 cc's of gas into your rectum. It's immediately absorbed into the rectal wall. It's highly vascularized. And studies have shown that the peroxide formation occurs in 3 seconds. Now, the beauty of it is that those peroxides are pouring into the portal vein system, which goes through the liver. So, once again, you're detoxifying the liver primarily and with that, okay? And if you put some liver drainage remedies supporting that, boy, that's a great way to nurture and take care of your liver, and that works extremely well. An interesting study was done a number of years ago where they put these people on 10 weeks, once a week, rectal insufflation for 10 weeks, twice a year. Not one of them got cancer in 25 years. Not one person, and this was done in a little village in Germany. And simple thing, after your first bowel movement or you do a coffee enema or whatever the case may be, you take the bag, squish it up there, and that's simple longevity technique. And Kelly's very versed at that. I just wanted to, you have to block that out.
I just like the sound effects.
I do too.
Sorry, Kelly.
I love it.
I have to edit that out.
But that's something you can do at home.
Yeah.
Absolutely.
That's something you can learn
now,
to do
what's
this.
important is that, let's talk about ozone generators. That's, that was a big issue with our academy, making sure that the ozone generators are, once again, producing, once again, careful, precision ozone delivery and clean ozone, pure oxygen ozone. So your resource for the instrument has to be pure oxygen, medical grade oxygen. The instrument itself has to be totally ozone resistant. That one component has to be, subjugated to the strong oxidation of the ozone itself. And there's been, interesting things, but the best, like longevity, Philozone, which is not my company, but is, Cetical. These are companies that have quartz crystal induction tubes that make the ozone. Because once again, the oxygen flows into the instrument itself. It's basically in a tube that's going through a double line tube that has like an energy field in it. It's almost like a lightning storm. And the longer the oxygen's in there, the higher the concentration, or the quicker it moves, the less concentrated. So you're able to manipulate that to get the concentrations you want. But every component has to be pure oxygen ozone. No component has to be subjugated or basically oxidized from the treatment itself. So that's instrumentation is key. You can't do things with ambient air ozone generators. You can't do that on patients. The physics are vastly different. And plus, it's toxic as hell because what you're doing is you're oxidizing the nitrogenous compounds in the air. So pure oxygen ozone, quality instrumentation. And that's one of the foundations. And to get that squared away was very, very important.
One of the things I'm thinking about is that, the world of health optimization through like supplementation and such, the sheer cost and amount of money people invest in supplements and such can be so astronomical. What type of investment are people looking at if they were to implement some sort of at-home ozone system?
Probably a couple $1,000s. You don't go cheap on this. You know, like Longevity, corporation has, a home ozone generator unit that comes in a nice case. That they have a number of patients using that. And I've had patients come from Manhattan, have suitcases, saying, "Oh, this is wonderful. This is the best ozone generator." Open it up, and they're like stainless steel tubes, rubber ends. I mean, it's toxic as hell. So you have to do your homework and make sure that if you're going to invest in it, because once again, it's a beautiful thing. The sad part about a number of years ago when we had that COVID thing, remember that?
Yep.
Okay, seems like yesterday. Ozone IVs and vitamin C IVs knocked it right out. And those poor physicians that were doing it got tortured because, it didn't play by the rules at that particular time. It was unbelievable. Unbelievable. Simple 1 or 2 treatments with ozone, a couple of treatments of vitamin C IV, and very inexpensive.
Right.
What does it cost? Nothing. And ivermectin, but I don't want to get into that. But once again, it was pretty amazing. But the trick is here, and once again, I love the integrative model. That's what we have at this school. So, ozone, beautiful, but it's a piece of the puzzle. Where is the patient? What are they doing? And that's important for any biologic dentist or any dentist today. You ask these patients, what are you doing? Because everybody's doing something, especially about herbal medicine. You have to make sure you ask these patients, are you doing any herbals? Herbs are medicine. People think they're like supplements. It's vastly different. Herbs are ancient medicine, and they serve a specific purpose for a specific time. It's like I've been taking echinacea for 6 months. Okay, about 5.5 months ago, it stopped working, by the way. It's a 2-week immune stimulator. That's the end of it, or willow bark or ginkgo. You take a tooth out. Oh, why the hell are you bleeding like crazy? I can't say. Well, because, willow bark is what? Aspirin, and ginkgo is another, blood thinner, per se, a brain drainage remedy. So, it's kind of an interesting, different way of looking at the world these days with your patients. Consider, part of our program at the school is to educate our docs on the different healing methods. There's a Chinese medicine, herbology, homeopathy, naturopathy, all these different things people are doing today. So it's important to understand what they're doing. And I'm sure Dr. Blodgett has seen, once again, patients come in with, the bag of supplements. That's always a big one. The shopping bag full. And why are you taking that? Oh, I don't know. It looked good, or somebody said I should take it. Well, you don't need 6 pounds of vitamin B. Let's reduce that down to a couple of milligrams, and you'll get a much better effect. You're creating the greatest fertilizer known to humanity. But that's another story.
Well, we thank you, Phil. We so appreciate this. As we end, I would love what we ask our guests, what does whole health mean to you? We'd love to know your perspectives on that.
Whole health. First of all, waking up in the morning and feeling good. Okay. I think that's important at this point. And, whole health is really everything. It's, nutrition, relationships, love, support. I think it's really just the way your perspective of the world is, and it's a complex world out there, but you know what? You got good family around you. You got good nutrition, good food, whole foods. Stay out of the middle aisles of the supermarket. Go in the periphery. And even then, who the hell knows what you're getting? I'm not sure what organic means anymore. But once again, it's a state of mind, Kelly. You know that. It really is. I wake up in the morning and say, thank God, I got another day. Now it's up to me. And anybody asks me, how you feel? I feel great. Even if I feel crappy that day, I feel great because you know what? I can say I feel great. So one day I'm not going to be able to say that. Woo-hoo. But right now, it's just, a matter of perspective in life. I think that, the mind, the body follows the mind. And that's really, really important. It's once again how we see the world and go from there. I mean, I'm just happy to be lucky enough to have been put in this direction, thinking differently. And that's what's important. Thinking a little bit differently than falling into the world of the lemmings, which I don't fit too well.
Well, thank you so much, Phil. I want to thank you for everything you have done for my own personal journey. You've been a wonderful mentor to me, and also for all the time and energy that you have put into traveling around the world to share simple truths like, the value of using energized oxygen, something that's so easily available. And man, your understanding of it's amazing. And I think we both thank you for that wonderful explanation at the start of what is ozone, simplifying it for us. So truly appreciate you, my friend.
No, I'm glad to do it, and I'll see you relatively soon. I'll put that snow out for you, just as a friend.
Hey, thank you.
Thank you so much for being with us.
Oh, it was my pleasure. A lot of fun.
Thanks so much for tuning in to the Whole Health Podcast.
If you enjoyed what you heard today, please follow us on social media and wherever you listen to podcasts.
You can find out more about us at thewholehealthpodcast.com.
You can find me on my website, blodgettdentalcare.com.
And you can find me at bioloungepdx.com or learn more about my organic soluble fiber supplement, Fluorosophy, at thinkfluorosophy.com.
We look forward to seeing you next time